Hello, everybody. Good afternoon, and welcome to our next installment of BBB's COVID-19 webinar series. Today's topic is Reopening Now What? My name is Luke Fry. I'm the Associate Director of Communication for BBB Serving Connecticut. Just a reminder that everybody is in mute, and if you have any questions, please feel free to type them in the questions box, and we will try to cover them all during our Q&A. We anticipate having a lot of questions today, so please type in your questions as they arise. Also, today's PowerPoint is available to download, so if you go to the Handouts tab, if you are logged into today's webinar on the computer, you can go to the Handouts tab and download today's PowerPoint. So today, we are happy to have Mark Soycher. He is the Human Resource Counsel for CBIA. He's here to talk to us about what a small business has to do in order to reopen safely and legally. I'm going to cut my intro short since we have a lot to cover in a short amount of time. So Mark, I'm going to turn things over to you, and then we will do some Q&A after you are done.
All right, thank you, Luke. Look forward to going through this. These are a lot of issues that I've been discussing with companies for weeks now, anticipating reopening and moving forward with that. And so let's just jump right into the slides, and I will qualify things as I go along. There's a lot of rabbit holes we can go down. I'll try to avoid getting lost in them. But there will be some points I'll detour from the information on the slide to go into a little bit more detail and then move past that. But I would welcome questions as they arise, and if it's something I'm planning to cover in a little bit, I may put you off for a moment, or I may address it at that moment. So please, as Luke has suggested, submit any questions as they crop up. Just a slight look backwards for a moment to see where we're coming from with all of this. We're on the cusp of starting to re-engage with some business activity that's been shut down almost completely for many weeks now. Back on March 10th, which seemed like years ago, one of the earlier executive orders that Governor Lamont issued was to place restrictions on non-essential workplaces or businesses, and essentially shut things down for a period of time. And these are just some excerpts from some of the from that one of those early executive orders. And it indicated that in the top right there that effective March 23rd, 8 p.m. through, at that point, it was anticipated just through April 22nd, non-essential businesses were going to shut down by 100%. And then a little bit further, it makes reference to, in the lower right panel, certain critical infrastructure sectors that have been really identified as essential employers were permitted to remain open, but with certain restrictions or guidelines there. So move on to the next slide. Fast forward from March 10th to the most recent executive order, which was issued, I believe it was Monday evening, and that was executive order number 7PP, which means we've gone through the alphabet. And as you can see in the left-hand panel, there's a reference to 42 executive orders that have been issued in order to address a variety of public health and safety issues to mitigate the effects of COVID-19. And in the right-hand panel there, it says Phase 1, business reopening, as a result of making certain headway with a number of the metrics that have been tracked to monitor the progression of the disease and everyone's efforts to stem that. We've made significant progress, and so the plan has been, as issued here, to open up certain of the non-essential businesses in 5 sectors, and I've got them listed at the bottom there: hair salons and barbershops, museums and zoos, offices, restaurants, retail, and malls. Those are the 5 areas addressed through this most recent reopening effort. And in the top right, there's a reference to sector rules. And those are standards that the governor, along with a substantial committee of representatives from the public health area, political area, economic, business, and industry throughout the state. And I know CBIA, our president, CEO Joe Brennan's been very active on the governor's committee in working on a variety of the issues with businesses. And they've developed some standards for what businesses need to address in order to reopen. As of today, May 20th. It doesn't mean they have to reopen May 20th, but if they choose to, they may, as long as they subscribe to certain designated criteria that will still retain many of the protective measures that we've been adhering to for many, many weeks now. One distinction to point out before I proceed to the next segment, the safe workplace rules for essential employers have remained in place. There was some question about those standards expiring May 20th, but in this latest executive order, 7PP, there is a statement in there that says the safe rules for essential employers will remain in place. So those essential industries, manufacturing, construction, a variety of healthcare areas, financial, legal, they've been subject to a wide range of protective measures that they still need to comply with going forward. So what I'm going to be addressing in a moment, dealing with those 5 sectors indicated in the lower right there, are the specific criteria for those business sectors that incorporate many of the standards the essential industries have been following up until now, and in some cases unique to those particular industries. Quick note on those. While originally they all were to be permitted to reopen as of today, May 20th, within the last about 24, 48 hours, through input from some in the hair salon and barbershop industry, have prevailed upon the governor out of concern that there wasn't sufficient protective equipment and other measures in place. So that's been their opening has been put off until June 1st, I believe it is. And restaurants, it's outdoor only, and I believe restaurants can't have indoor service at this point until June 20th. But the others have been advised that they may resume operations with some limitations effective today. So if you can move on to the next slide, and let me say I will touch on each of these very briefly, each of those 5 sectors, and then get into what I have culled out from the guidance materials, what I consider to be common elements of criteria that businesses need to pay attention to in order to properly move forward with some degree of business operations. The state has on its website guidance materials in each of these areas, essentially a guidebook for proceeding, and just representative of some of the information that's there here for hair salons and barbershops. They include schematics of the typical physical layout and some highlights of areas of concern to be watchful for and to address. I'm not going to get into the details on each of these slides right now, but just to illustrate how each sector has some unique elements included for the particular environment in which both employees, the owners, customers, contractors, et cetera, may be operating in these contexts. So this is representative of this particular segment of the industry. On to the next slide, Luke, please. Museums and zoos, outdoor only. Again, a schematic of what might be a typical operation of this sort. And I did speak with one of these facilities yesterday for quite some time, and they're explaining to me all that they've gone through to try to arrange appropriate controls to allow patrons to come in and experience the outdoor exhibits that they have. And it's been a bit maddening, quite frankly, with the signage required, stations for hand sanitizers and wipes, things like that, restroom facilities, some very, very limited food service there that is quite a bit of expense for them. And but hopefully with the weather changing, outdoor activity of this sort will be an attraction where people will feel safe and comfortable going to, and will take advantage of the opportunity to get out and about in a safe manner.
Mark?
Next slide. Yes.
Mark, we have a quick
Yes.
question on that topic. If someone operates a mixed-use space, how do you decide when you can open? For example, in one building, they have an exhibit space, like a small museum, but they also have retail space in it to sell their products. So how do they decide whether it's retail or a museum?
Good question. I'm going to duck behind. I'm not sure. I would imagine that the exhibit space, if it's outdoor, should be they should focus on these guidelines here for the museum outdoor exhibit activity. And if they're also operating retail, then I think as I progress, you'll see there's a separate set of guidelines for retail operations and how that can be handled. I know in speaking with the facility yesterday that's in this industry, the indoor exhibit space was not opening because that's not permitted yet. And so, but I think it's a matter partially of thinking about the nature of activity that takes place in that space. In a retail area, people would be shopping, making a purchase, possibly looking at items for purchase, and then making a selection and then leaving. Indoor exhibit areas, it's intended to be available for people to linger, explore, and more difficult to facilitate accessing indoor exhibits by limited numbers of people, whereas retail is more a one-to-one transaction between a patron, a customer, and an employee. So I suppose they could sustain the retail activity, but hopefully if there's no exhibit space, or if there is exhibit space there as well, that would be roped off in some fashion.
Thank you.
These are the questions we're making up answers to as we go along, because it's next to impossible to address them to the detail that might be warranted. Offices is the third area of activity that's permitted to open up as of May 20th today. And again, an image here, it looks kind of like a little dollhouse type setup, but illustrating the various activities that take place, whether it's workstations, reception area, break room, kitchen, various equipment that may be there, copiers, things like that. So just to try to give a visual to what might have to be done. And I'd note, you can see in the dark blue panel on the left there, it says in phase 1, offices can open up at 50% capacity. 50% is referring to the capacity based on the building code. How many people can be permitted to come there and work during the course of the day, rather than 50% of the organization's workforce. So that's my understanding of how that 50% is intended to apply. But again, as you'll see in a few minutes, there are standards for spacing workstations and people moving about in a facility, so that if 50% capacity for the tenancy, what the landlord says a tenant can bring into that location. If 50% of that number is the total workforce of that employer, they might still not be able to bring them all in because they couldn't maintain appropriate distances between each worker at their workstations. So more to come on offices. Move on to the next one, please, Luke. Restaurants, fourth sector of the five that are reopening, and here again, outdoor only for the time being, and no bar service inside. And as illustrated here, got to have the proper spacing and other elements for cleanliness, sanitizing. It says no reusable menus, either paper menus or something written on a chalkboard or whiteboard, tables spaced out, things like that. Nice opportunity to get out and about again with this type of thing. Bear with me one moment. My computer just froze up, but there it goes. When it's not active, it goes to sleep. Woke it up again, so I've got it here. So outdoor activity going to depend on the weather. As with the outdoor museum displays, a lot of investment in pulling all of this together, and then dependent on Mother Nature with the weather and the ability to sustain comfortable activity outside like this. So a lot of challenges with this, but nonetheless, restaurants will be allowed as of today, in accordance with the standards I'll go through in a moment, can resume operations. Next slide. Retail and malls, and this too has substantial challenges because in some cases it's a storefront on an outdoor busy street. In other cases it'll be indoor in a mall area, and a variety of criteria here with social distancing, appropriate personal protective equipment, physical barriers at checkout places, contactless payment, partitions in place where it may be difficult for an employee to maintain a 6-foot distance from a customer. So a lot of criteria here to be aware of in a retail setting. Spoke to another retailer earlier in the week, and it was suggested that they will be bringing people in on appointment only, and so it's going to be real concierge service. Very much appreciated maybe by the customer, but it's going to substantially cut down on the volume of traffic that will be permissible. So these are some of the challenges that we're dealing with. So we can move on. So those are the 5 sectors that have been deemed permissible to open up in this phase 1. Now, I want to move into the common elements here. These are items extracted from several of the guide booklets that are posted on the state's website in each of those 5 areas. And there's significant overlap among them with some particular unique elements for each industry. I'm going to sidestep getting into the unique elements for the particular industry. For example, in the hair salon and barbershop industry, there are some other elements involved because of the nature of the tasks in providing someone with grooming services as compared to in an office setting. But I'm going to focus on the common elements here and try to go through them rather quickly just to give an idea of the areas that employers will have to focus on in pulling together. And these are elements that, in accordance with the guidelines, must be addressed before opening. So it's not something that you can say, well, we've got 60 days to get to a lot of this. There are some preliminary steps that have to be taken, and then there'll be some ongoing tasks that will be required. So as an initial step, plan for reopening. These elements will have to be shared with employees, and I'd suggest possibly either online or printing out the guide for each of the industries or the industry in which you're operating and sharing that information as one way of educating employees. Appoint a program administrator. Critical to have somebody in charge of all of this, both to have a safe landing place for individuals who have questions or looking for guidance, as well as to hopefully have some consistency with the direction that things are going in, and to make sure that someone's checking off all the boxes to make sure things are being taken care of. Personal protection equipment, something universal these days, and difficult to come by in some cases. I know CBIA and our partner Constep has been very successful in obtaining some PPE that we've been able to distribute to some smaller businesses. There are a variety of other outlets where those who've had difficulty getting PPE may be successful with that. But it's critical to have that available for individuals. A little bit more on that further along. Having a cleaning plan. Checklists are the watchword here. Make sure you're running down those items, and then thoroughly cleaning the place before opening up to make sure. If the facility has been vacant and shut down for an extended period, it may not need the disinfecting that might otherwise be necessary in an active work environment, but nonetheless, cleaning is going to be a constant activity. And training is a requirement in all of these sectors, including training all employees. There are two primary areas of training that need to be focused on. One is, as the first bullet there indicates, the rules contained in this document. So reviewing what the overall standards are that employees should be both educated about, as well as reassured that if these things are being taken care of, the workplace should be a safe and suitable place to go to. And then the second area, besides the overall criteria that meet these standards, are protocols on how to clean, using cleaning products, including disinfectants, safely. The link that's included there is from the state of Washington's Occupational Safety and Health Administration, the state OSHA in the state of Washington. They've got a good fact sheet there on distinctions between cleaning and disinfecting and appropriate steps to take. We all think we know how to clean, how to disinfect surfaces and the like, but the products that we've been using may not be the most suitable, may not be the safest in some cases. So this is an area where education will be necessary. If a facility is rented and there are subcontractors that come in to handle the cleaning, it will be the tenant employer's responsibility to ensure subcontractors are appropriately educated about this as well. As with other training, harassment prevention training that has been set aside for the moment, training activities like this is considered working time, so employees do need to be paid for the time spent in the training. It can be done online, I believe, with Zoom meetings and go-to meetings. Could be a suitable environment to walk employees through these areas of information. And be very much aware of employees for whom English is not their primary language. And if they are more literate in another language, pull in one of the coworkers who is fluent in the appropriate language and get some assistance there in communicating this. This is not an area where you want people nodding, smiling, and saying, yes, I got it, and then they have no idea what you're talking about. So it will be important to have everyone educated so everyone can contribute to this effort. Next
Mark,
slide, Luke.
Excuse me.
Yeah.
Quick question about the cleaning. Question came in, how do you deal with an issue where a landlord is not providing adequate services and cleaning of the common areas in the building?
I would, suggest, and it's easy for me to make the suggestion, maybe hard to make it happen, but to try to reach out to the landlord and say, listen, we need to work together on this, and bring to their attention what's not being done as specifically as possible, so that that can be adequately addressed. In some cases, the landlord may not be as sensitive to that as they should be, may not be conveying to the cleaning service what needs to be done. But I do think it's a good point, because in many cases where it's a multi-tenant location, employees may be moving through common areas that, if not adequately addressed, will potentially present a hazard, or at a minimum, a perception of an unsafe environment for employees to pass through. So prevail with the landlord if at all possible. I don't want to suggest the tenant should pick up the cost of extra cleaning, although some effort in that regard might be suitable if it's something that might achieve that result. I'll point out now, and I'll make mention of it again later. One of the elements of requirements here is a complaint hotline to indicate to the state that there's a problem, someone is not complying with these standards. And I just saw this morning on the state's website, they've actually set up an electronic platform for submitting complaints. And complaints can be submitted in someone's capacity as an employee, as a family member of an employee, as a customer of a retail facility, or simply as an observer of some non-compliant conduct, and submit that to the state. And a question that has come up at another point is, what's the enforcement mechanism here? And in the governor's order, executive order that I showed at the beginning, there is a reference indicating that failure to comply with these executive orders issued during a time of public emergency such as this are considered public nuisances, which can be addressed through both state and municipal police authorities, as well as local public health officials. And so a complaint could be lodged with any of those offices to get some oversight of the situation. Can't say how successful the effort will be and how quickly it'll be addressed. But there is that avenue in which a complaint could be lodged. And it is possible that continued non-compliance could result in a notice being slapped on the front door, shutting down the location until it's properly addressed. So not sure how readily that step might be taken, but that could shut things down quickly and maybe get attention to the matter. Next slide, Luke. So again, here with cleaning, through this in here as illustrative of some of the requirements and the specificity of some of the cleaning. The focus should be on those high touch point surfaces that are being used on a regular basis or touched as people move about. And as seen on the left-hand side there, there's references to the CDC and EPA about investigating and selecting appropriate cleaning products that will both clean and then disinfect. And cleaning removes the dirt. Disinfecting kills the virus and other germs. And so in some cases, cleaning may be sufficient. In other cases, disinfecting may be necessary as well. But when you think about moving throughout, in this case, an office area, touching desks, chairs, going into the bathroom, elevator buttons, common coffee machines, shared equipment that's used on a regular basis by any number of individuals, those are all now, we've got heightened sensitivity to those activities and touches that we make through the course of our day, and the fact that there are hazards lurking there. So those are areas in which extra cleaning or disinfecting is necessary, even if it's having a container of some type of disinfectant wipes that when you're done with the printer, you take a quick swipe on the touchpad for the next person who may be coming in. With things like coffee machines, you'll see in a moment there's another item posted relative to sort of community use items And the suggestion is start bringing your own lunch, bring your own coffee in, so that maybe we ought not to be using that common coffee machine in the office as a place where many people would touch through the course of the day. Next slide, Luke. A common theme among all of these criteria is while it's we're relaxing some of the standards to open up activity on site and come to work, if at all possible, the watchword is still work from home. Now, in a lot of offices, that's very achievable, and where possible, that should continue. However, obviously, with hair salons, museums, restaurants, retail, those jobs can't be done from home. But in some cases, if some of the back office activity can be done from a remote location, that should continue. And I think employers have realized that remote work arrangements are far more achievable and productive than previously thought. It's raised as well situations where employees may request a remote work arrangement due to a disability issue. And I think employers will be hard-pressed in many cases to argue that it's not a reasonable accommodation to provide an employee with a disability the opportunity to work remotely. In the past, that has been a common challenge to a remote work request arrangement, a remote arrangement request. But now, with the success that a lot of businesses have achieved, I think we've fine-tuned our efforts in doing so. Signage, there's requirements in all of the standards to post some notices reinforcing the various policies dealing with social distancing, cleaning, disinfecting, PPE, and work from home if you're experiencing, or stay home if you're experiencing any types of symptoms. The notation for having signage in the workplace is great, but a lot of people have been saying, where am I going to get the signs? Well, we've developed many appropriate signs for this purpose at the CBIA website that I have posted there. They can be downloaded for free. The CDC also has some good literature in various areas like that. So exploring these various sources will be helpful and maybe give a variety of flavor to some of the notices that are put up. But download those signs, tape them up on the walls in various places, and you'll see, I think, it'll keep people focused on the right issues. Another element of the standards that are common to all of them is this daily health check. This is going to be a new protocol. As people come to work, employers should be screening them, not giving COVID tests because I think they're not sufficiently available yet, and considering that you're not going to be doing a test every day, and a test only tells you that person's health status up until that day. Ask Mike Pence's press secretary what happened between the day the test was negative and the next day when the test was positive. So I think that speaks to the shortcomings of testing. Testing is effective for identifying pockets of infection, but as a daily monitor for workplaces, probably not the most suitable mechanism for dealing with that.
Mark, we have a quick question about the daily health checks. Is that something that
Yes.
employers and landlords should be evaluating in buildings with many tenants?
I'm not sure if the health check itself would be something that a landlord should be addressing, because I think it would be an employer responsibility. And we've actually posted a couple of forms and a sample memo on the CBIA resources website that is a checklist that could monitor someone's temperature every day when they're coming to work, and to ask them to indicate whether they have had contact with anyone who's been exhibiting any symptoms or who's been diagnosed as ill, or if the employee, him or herself, has experienced any of those indicated symptoms. Previously it was initially it was just cough, shortness of breath, or a fever, and it's been expanded by the CDC, and it's worth checking with the CDC periodically to see if that list expands any further. But some of these other symptoms have been deemed indicative of potential COVID-19 diagnosis. So we've got a sample memo that could go out to employees to say this is what we're going to be doing, because these types of communications, you don't want to catch people short with this. It's helpful to both reassure them as well as to enlighten them about the new process that will be in place. I think that it might be impractical for a landlord to have that type of screening process at the entry of a building that may have quite a few employees coming in. Obviously, though, that does, as I'm saying this, I'm thinking that last thing you want people doing is going into their workspace, hanging their coat up, putting their things down on their desk, clocking in, moving through the facility, and then going for their health check to tell their supervisor that I've been experiencing a fever and chills and not doing particularly well these days, and then being told, okay, leave. You do want to limit access to the facility for anyone who might be experiencing health symptoms so that they don't spend a lot of time there and can safely get home and monitor their health further from there. So backing off my comments slightly there, but I do think that it would be impractical for a landlord to be the gatekeeper in that situation. The reference in the lower right hand to leave, there's been a series of new provisions through the Labor Department to address expanded emergency paid sick leave, expanded paid FMLA leave when employees experience health problems themselves or have family members that they're caring for, or a child whose school or daycare has been closed down. Employers need to educate themselves about those requirements, provide the paid leave where it's appropriate, get documentation where it's appropriate. And again, this is an area where management needs to be educated so that they can clearly explain what the arrangements will be when an employee is told they can't come to work, or an employee calls in and says, I'm not coming to work. Center there in the bottom, in the bottom center of the page, in the event of a positive COVID-19 case, it's not if, but when. Most employers have experienced some instances where employees exhibited symptoms or have been diagnosed, and everyone's going to know about it. The guidance is respect medical privacy, don't reveal individuals' names, but appropriate to alert employees that one of our colleagues has been diagnosed and is taking leave, and hopefully will recover, and then to reach out and do some more aggressive cleaning in the work area where that person has been, and then alert the rest of the staff to continue to comply with the more stringent cleaning protocols that we're all following these days when we are in a work setting. But again, having a plan in place to address this rather than waiting until it happens and then stepping back and saying, what do we do now? And again, we do have some literature posted on the CBIA website for guidance and how to communicate and manage that situation.
Mark, can health practices be exempt from FFCRA, and why or why not?
There is the U.S. Labor Department, and on the very last slide, I've got a link to the U.S. Labor Department's lengthy series of Q&As on the Families First Coronavirus Response Act, the emergency paid sick leave, and the expanded FMLA leave. And within those series of questions, there are exemptions for healthcare workers and small businesses. Healthcare workers, the exemption is from not familiar with all of the details on that. It hasn't come up too often. I believe it's from some of the provisions of the paid leave and having to give the leave, but the reality is if someone is ill, they're going to stay home, and you want people staying home in those settings. I think that the expectation is that they will practice implement appropriate measures to monitor people, give them time off from work when necessary. I believe the exemption, as I'm saying this, is from the child care responsibility, the leave for child care. It's certainly not practical in some cases, but to put some added responsibility on individuals who've chosen to work in that profession, not to try and make arrangements for child care through someone else so that they can continue to come to work because they are deemed to be essential workers, and therefore not to have individuals disappearing from those work practices.
Before we move on, we have two questions about work from home. One question is, are employers obligated to have their employees work from home, or is it just a suggestion?
The guidance has been when at all possible, work from home should continue. Okay. So if an employer prefers to have individuals working on site and not working remotely, would an employee have a basis to file a complaint if denied the opportunity to work from home? They can certainly file a complaint. I don't know that would be deemed a violation because in some cases the work can't be effectively done remotely, and it may only be fill-in work that's been done more recently remotely. But I do think that employers should stretch as much as they can, and that requires managers educating themselves, getting comfortable with new modes of communication, monitoring, delegating, evaluating work, communicating with employees. One of the examples I often use is, in an office setting, for example, there may be someone in your same office complex who you think is working on site every day. How often do you send them a text, email, or place a phone call, and you get voicemail? Are they at work that day? Probably, but they're not picking up their phone at the moment. So we're communicating that way on a regular basis anyway. And so the fact that the person may be 10 miles away rather than, down the end of the hallway may not be that significant a disruption to the ability to effectively manage and get the work done. So, but if the preference is to work from home purely because it's safer, that's less of an obligation on the part of an employer as compared to a worker who says, I need to work from home because I have a disability that puts me in a high risk category. Then the accommodation of working from home may be under the auspices of the ADA law as a reasonable accommodation rather than simply a preferred safe work practice under the current protocols that exist with COVID-19.
What about work from home when there are child care issues?
Well, presently the the expanded paid FMLA leave does provide for a legal entitlement under an expanded aspect of the traditional or classic FMLA law. Applies to companies of any size, not just those with 50 or more employees. In this respect, if an employee has a minor child at home whose school or child care program has shut down because of COVID-19, that employee could request to work from home, and the employer would have to accommodate that employee for 10 weeks or up to 12 weeks in some cases, and pay the employee at 2/3 pay for that period of time, and with proper documentation, which would include the dates, name of the child, the age of the child, and the name of the school or child care provider that is unavailable. The employer could then recover the costs of that paid leave period through a payroll tax credit under that law. and a statement to the effect that the employee is the only available caretaker for that child. It's not intended for both parents to remain home if they're both available. But if one is working full-time at home and can't watch the 7-year-old, then the employee may be the one designated for that. Some other elements here of the overall program that employers have to be alert to and incorporate into their safety program to comply with the new environment here is shift work, splitting the workforce up into 2 or possibly 3 segments that will rotate as they come in, so there are fewer people in the office at the same time, and thereby continuing working from home in some cases. Logging employees coming in, both to keep track of compliance with minimizing staffing on site to the extent necessary, and then also to track who's there. So if someone does contract COVID-19, the contact tracing that the public health officials are implementing will then be able to identify who's been in contact with who and can trace these people down to check to see how their health is, or possibly to see where else they've gone to then identify and hopefully limit any further outbreaks. Visitors shouldn't be there. People shouldn't be having friends, family members visit them at work. If it's a business visitor, contact should be limited and contained in certain areas. Discrete work zones on the left side. Again, as I said, that could apply in various contexts. In an office setting, spacing out workstations, or telling people stay in your area. If you normally might go over and say hello to a colleague, don't do that these days. Send them a text message, maybe a video conference or a phone call, but stay in your identified work area that's necessary to complete your tasks, and don't go wandering about unnecessarily. And that can apply in retail as well, assigning a sales clerk to a particular area and not having them wander around quite so much. Social distancing markers. Any of us that have gone out for any kind of takeout food have seen the tape on the floor to keep certain distances, and that can be appropriate in various areas. Saw on the news recently in a public park, they had drawn circles on the grass to identify safe places for people to camp out and maintain distance from others who are enjoying that area. Ventilation, expand the ventilation if you can. Open windows if they do open. Maybe speak to a landlord about servicing the ventilation, the HVAC systems to ensure that they're working effectively and moving as much air as possible so that there'll be fresh air coming in. Did speak to a company the other day that has a shared ventilation system with another tenant in the building. And how do they know? Well, they know when that other tenant makes popcorn in the microwave because it filtered into their space. So that calls for the need to speak to neighboring tenants in a building, speak to a landlord about ensuring that the ventilation system is working properly and effectively. Next slide, Luke, please. A variety of issues here. Non-essential amenities, that's what I was referring to earlier with things like common areas. Bring your personal possessions to your workstation. Bring your lunch in. Coffee is an essential amenity, but it's not essential that the employer provide it any longer. So people should be bringing in their own drinks, whether it's a soft drink, to the extent possible, not storing it in a common location like a refrigerator where everyone has to go. Shared equipment, whether it's manufacturing, retail, or an office setting. Hopefully using your own staplers and other devices like that. Partitions where 6-foot distance can't be maintained, establishing some more substantial partitions. Bathrooms cleaning as much as possible, and to the extent feasible, moving throughout an office, including bathroom spaces in some cases, propping doors open so that people are not touching doors going in and out on a regular basis. Certainly for privacy purposes in bathrooms, certain doors will need to be closed, possibly sealing off certain stalls if there are many, many stalls in a bathroom area, so that there's less use of some of the facilities. Hand sanitizers being available, especially when hand washing is not available. Hand washing, we've all washed our hands ever since we were little children, but if you look at some of the videos that are out there, particularly for healthcare providers, it's very enlightening to see the appropriate way to make sure all the surfaces on your hands are washed. And it will take at least 20 seconds if you go through the routine. Interesting videos worth showing for any number of employees to really tune into the appropriate steps to take with that. And then touchless appliances, to the extent that you have them, make sure they're serviced and operating properly, whether it's paper towel, soap dispenser, or even doors. The devices that we've implemented for the disability community with mobility limitations now are golden for all of us. You can do a hip check on a door opener so that you don't have to touch the door. The bar type handles rather than a knob enable you to open a door with your elbow or just leaning against it, pushing it down. So having those devices is really very helpful in this context. Next slide, Luke. I've got 2 slides here on personal protection for employees in order to focus on an issue that I've had a lot of conversations with companies over the last few weeks concerning face masks. It is employers' responsibilities to provide face coverings for employees if they don't have them themselves. They can be cloth, it can be, the more papery medical masks that are a little bit lighter and maybe a little bit more porous. But the standard there, that last bullet, I just want to focus on that. It's that in work settings where workers have a segregated space, meaning a closed cubicle or private office, they can take their mask off. At all other times, from the moment they leave their vehicle or public transportation and enter the building, they should have a face mask on as they're moving through any public area in a facility. And if they're in a larger congregate space that they don't have that private segregated space, the mask needs to be kept on. Only if someone has a private area, they can take it off. But if they get up to go to the bathroom, to get a drink of water, to go to the copier, to go to speak to someone face to face, that mask has to be put back on. There is a provision that in the standards that say if using a mask might create a safety or health hazard to the individual because of an underlying medical condition, they can't be required to use the mask. And in that case, they can't be required to produce medical documentation, but they can be asked, what's the problem? Where is the difficulty arise in using that mask? A lot of employees have been thinking that they merely can say, I have a medical condition, can't wear a mask, and that they can be relieved from that responsibility. I don't believe that's the case. I believe that employers should still respect medical privacy, but can ask, what's the difficulty? Is it nausea when covering your mouth? Is it respiratory difficulty? Do you have a panic attack? Is it glasses fogging up, disorientation, dizziness, whatever? Because instead of a mask, maybe approach it like an accommodation request under the ADA. A face shield might be a suitable alternative, or a different fabric that may be a bit more porous. But all of the guidance has been social distancing, and using masks is one of the key, or 2 of the key elements in limiting the spread of COVID-19. And those who are suggesting it's either a sign of independence or rebellion not to wear a mask, or they have a medical condition, which they're not speaking truthfully about, is not a basis to ignore this criteria. So this is a standard that applies in all of these settings, and I really think it's something that has to be stressed and is critical to enforce. Next slide, Luke. Just a reference here that for businesses, if they don't have adequate PPE, they can't open up. If a customer were to refuse to wear a mask, or an employee were to refuse to wear a mask, I think a business could say, you have to leave. You're not allowed to enter the facility, as it states at the end of that second bullet there. And in a manufacturing setting or an office setting, if a worker refused to wear a mask or could not be accommodated because there's no suitable alternative, that worker could be told, I'm sorry, you can't stay here. I think the public health emergency of COVID-19 is too grave and has clearly been established as a pandemic public emergency, and so the prevailing wisdom would be that worker would be told, you cannot come to work until the situation is resolved. They might be eligible for some paid leave time under the federal law, or if not that, possibly unemployment benefits in that situation. That's a whole nother conversation, but I'm stressing using the masks because it really is critical. Next slide, Luke. There's provisions that require whistleblower protection notices, hotline for violations, and then the certification process. The whistleblower protection and hotline for violations, as I said earlier, there is a landing place on the state's coronavirus website for submitting a hotline complaint notice to the state, the 211. Whistleblower can't retaliate against someone who's complained. Rather than viewing the whistleblower issue as an us against them situation, my advice would be to put out a message that says something to the effect that we are doing our very best to ensure safety for all that come to our facility. We'd like to know how we're doing, and if we're missing something, we invite people to contact and then fill in the blank. HR, facilities manager, safety director, what have you. Let us know. We may not agree with you, but at least we need the opportunity to take a look at where you think we may be coming up short. And you'll certainly not be retaliated against for raising such concerns. I think that type of message is a positive message to sustain the protections for whistleblowers, to solicit that type of input that often comes through safety committees, but now is expected from everyone, to identify situations where may be coming up short, rather than having the whistleblower be seen as a dark, threatening presence in the workplace. Instead, it should be an alert system for mistakes that may be made. The certification process is something that is available. It's voluntary, but it's a checklist of going through, checking off that you've done all of this. And as the result of going through that self-certification is you'll get a 3-page poster that has these 2 panels here in both English and Spanish, indicating that you've taken protections in these areas, and this is what you're doing for your workers, your customers, your contractors, your constituents. And these are in the right-hand column, these are the things that you will be doing for us if you continue to comply with all of this. And then on the next slide is the notice that businesses can post to display that they have self-certified compliance with all of these criteria. The essential businesses are not required to go through all of this and to self-certify, but they may if they choose to, and I think a lot of businesses will be doing so, both as a public display of their responsible conduct in this area and as a reassuring message to employees and constituents that appropriate steps are being taken. Don't take the self-certification process too lightly. You can go through the process and get the self-certification certificate without doing any of this, but you may get called out on it because it will be a public display that you've done all of this, and you don't want to do damage to your organization's integrity by suggesting that you have when in fact you may have come up short with some of these things. Next slide.
I have a quick
Yes.
question on that.
Yes.
Do companies that never closed because they were deemed essential, do they need to
Yes.
get certified too?
No, they do not. Nor do they have to subscribe to the very detailed list of areas that I indicated there. Instead, there is guidance on the state's website, safe rules for essential employers. It covers a lot of the same issues, but I think that a business that's an essential employer that wishes to in a more disciplined fashion structure their safety program, it would be wise for them to take a look at these set of criteria and consider incorporating many of these elements. If they do choose to self-certify, they're going to be checking off that they have done all of this. And so while it's in a sense going a bit above and beyond, I think it is a worthwhile path to consider going down. This last slide here are some of my favorite places. There's many more that people have been relying on, but there's the link for the sector rules that I've gone through that will provide a link to each of those 5 industry areas. There's a small business reopening resource guide from the state of Connecticut that has some suggestions on the training process, how to go through all of this with your employees. The CBIA website and Constep, we've got extensive resources there and growing every day. We're continually posting new information there, and many other industry organizations, Retail Merchants Association, Restaurant Association, Food Store Association. I'm sure they've gathered some unique information for a particular industry that they're serving. The Families First Coronavirus Response Act Q&A, that's from the U.S. Labor Department dealing with the emergency paid sick leave and the expanded family medical leave. The next link is the IRS, which has guidance on how to obtain the tax credit recovery of the costs for the paid leave. Next one is the Labor Department. Connecticut Labor Department website has a constantly updated series of Q&As dealing with the unemployment system, which was initially in turmoil and now I think has gotten its act together. Good information there about the unemployment system, how it's being administered in this environment, including detailed information on the expanded unemployment benefits for those historically not eligible for unemployment, and the extended benefit period there's an additional 13 weeks added on to the Labor Department's traditional 26 weeks worth of benefits. The CDC, obviously a very in-depth and constant valuable presence for information about the disease itself and various practices, whether you're caring for someone who's ill, how to care for yourself, when it's safe for someone to come back to work, and CBIA website there. Last slide. Thank you. Be smart, be safe. Consider joining CBIA if you're not a member. There's my contact information, phone number, email. I am getting my office email and voicemails forwarded to me while I'm working remotely, and hopefully to continue to converse on these issues and help people with all of this. We do need to work together, and we'll get through it. I think it's a sign that we're reopening some sectors today, that we're making progress. We should be very, very careful. I've seen in the news media some very good articles about not letting the guard down. Just because it's okay to go out and go back to work and eat at a nice table outside at a restaurant doesn't mean you can lightly take off that mask and get up close with people and fail to continue to clean surfaces and things like that. We've got to be disciplined with this, and we'll get through it. With that, I'll end. If there's any remaining questions, either now or through email or phone. Thank you.
All right. Thank you, Mark. I know you have another meeting to get to. We appreciate all of your help going through all of these precautions and, legal suggestions, I guess, for businesses to open up. Remember, we are going to be posting a link to the recording of today's broadcast, and that link will be emailed out to all participants as well. Thank you again to Mark, and I hope everybody has a great rest of your afternoon.
Thank you, Luke. And if there are other questions, I apologize. I've got a meeting with CBIA about reopening our office that I have to go to right now. So, but I wish everyone well. Thank you.
All right. Thank you.